In response to threats of massive industrial actions received from the Guyana Public Service Union, Chief Executive Officer of the Georgetown Public Hospital, retired Brigadier George Lewis, during a recent interview sought to clear the air by informing that the risk allowances, which the healthcare workers have been making calls for during the past 2 weeks, are currently being paid to 257 employees of the hospital. Lewis further explained that prior to the COVID-19 outbreak locally, the allowances were being paid to primarily those healthcare workers who serve in the infectious disease and psychiatric wards.
Since the advent of COVID and our first patient in March, risk allowance has been paid to different categories of staff. Indeed, prior to our first case, around about 20 persons were getting risk allowance. Now we're paying risk allowance to 257.
Lewis added that the risk allowance is paid to health personnel who are directly responsible for the care and treatment of COVID-19 patients. He noted that the hospital is guided by the 2019 circular, which outlines which category of workers should receive risk allowances.
Because the Public Service Union is claiming that all healthcare workers, all categories of healthcare workers should receive risk allowance. However, we have no authority to pay risk allowances to those persons because the circular to which I referred before does not facilitate or permit you to do that.
With regards to receiving adequate notice from the Guyana Public Service Union with regards to industrial action, Lewis accused the union of not following the industrial relations process.
But when we received the notice, that was long after there were protest action taking place outside of the hospital and around the hospital. And we felt that the process was incorrect. The process was against the law, and the process also did not follow the sequence of action that is supposed to take place before you take protest action or you take strike action.
However, President of the Guyana Public Service Union, Patrick Yard, had maintained that the ultimatum and notice of industrial action were served in 2019 to former Minister of Public Health, Valdo Lawrence, and Lewis.
Immediately on receipt of the ultimatum, the Minister of Social Protection, Abner Ali, and Minister Lawrence, Minister of Public Health, invited the union to meetings. At the meeting, based on both ministers' requests, the ultimatum was put on hold. And joint teams were set up to identify and investigate the grievances.
Yard added that subsequently a team was set up to identify and investigate the grievances of the workers and to make recommendations. However, that exercise, according to him, was a total failure. In a new correspondence dated September 30 to the Minister of Public Health, Dr. Frank Anthony, and retired Brigadier George Lewis, the union made reference to the 2019 notice. The union, in its ultimatum, pointed out that all healthcare workers, particularly those at the Georgetown Public Hospital, should be categorized as frontline workers and should be eligible for risk allowance. If demands are not met, the union has threatened strike action in 72 hours, which would expire on Tuesday. Healthcare workers first began to protest on September 24 at the Linden Hospital complex, days after similar actions were taken in regions 3, 4, and 6. Temika Rodney reporting for the HGP Nightly News.